who go against their own value system, their belief system, to support certain policies that they know within their own value, their religious beliefs, do not conform, to their beliefs, but they are afraid. If I don't support this, I might lose some money that I need to campaign. And if I don't have money, my chances of being elected is very, very low or small. So health, as with anything that is with the social needs, social concerns, as long as government is involved, there's some politics. And besides, as long as people are involved, even in local school and local healthcare systems, in local communities, in state communities, you have politics. Don't throw away the value of politicians kind of trying to influence what is to be done and what is not to be done. So health and therefore health policies are political because population's health is related to actions of the government and the policy environment in which people live. Plain simple. So because even right now with the as we are dealing with the destruction that COVID has created, there is still some element of politics being played. And most of it is based on politicians going after or responding to the needs of their supporters at their own detriment and at the detriment of the health of others. Politics is important in healthcare within every country, with government intervening in healthcare provisions across the globe in a variety of ways. Politics, when it's aimed to do good, to serve the real needs of everybody, is the biggest support you can ever have, because most of the time, especially with rich countries, they have the resources to effect change, to help other countries to implement certain conditions that can help improve health. But most of the time, how much of that willingness to support other countries to improve their health? So like right now, there is the issue of how can countries with more resources, how can they help those countries with little or no, or with little resources? Some people are saying right now, let's start helping before we say, oh, some are saying, well, let's use the vaccinations first to vaccinate our populations, and whatever is left, the leftover, will go to poor countries. Well, again, as you're dealing with a situation like a virus, the longer that virus stays within within the populations of low socioeconomic countries, the more they have the ability for them to mutate, form other new strands. So we might be thinking, okay, we are vaccinated, but if new strands develop out of this COVID virus, our vaccination will be almost meaningless, depending on the type of strand. So this is not one of those things wherein, okay, let me take care of is let's do the best we can all over the world so that we don't have this thing, this virus to mutate into a strand that can almost lead us into perpetually feeding the beast. If we reduce the prevalence of the virus in developing countries, as we reduce the prevalence of the virus in our countries or in developed countries, the better it is collectively we can all contribute to taking care of the virus. But again, it takes politics. It takes politicians who are willing to see this as an opportunity. There are many different clusters of values in policy making, often associated with different political approaches and parties. And when each hold our own ideology, now, usually there are various, value systems. And when politicians hold their own political views, their ideologies over the others, it makes it very, very difficult for effective policies to be put into play or in place that can be able to address health related issues. Ideology and healthcare, you have some conservatism. Now, what it means for health: reduction in public expenditure, expansion of the private sector, and increase inequality. Three, conservative, even right now with all the amounts that has been spent to take care of the COVID, you have some people who are saying there's too much money being spent already. Let's reduce it. And it won't be long before they say, okay, let's just leave it to, some will start saying, vaccination, let's leave it to the hands of the private sector. And private means you pay to play. If you don't have the insurance, the appropriate resources, the private will not take care of you. So it increased to inequalities. See, so this the conservatism is mimics almost the Republican view. Not necessarily the same in all aspects, but to a great extent, it mimics. Now you have the neoliberalism. It emphasizes both privatization and individual responsibility for health increased for health, and it also increased inequality. See here also, this is also a form of conservative view. So let's expand it, emphasize to privatization and individual responsibility when it comes to medical service. But there are certain things in which individual has little or no control over those situations. So as long as you bring in the private market into the picture, you are going to increase the inequalities. Those who are going to have effective primary health care and effective health services, and those who are not going to have it. And in most of the time, are minority populations, and also some poor whites, because all the time just saying minorities populations are going to, at times you are also going to hurt whites who are poor, who do not have insurance, who do not have access. So those two, conservatism and neoliberalism, all, they provide services, yeah, more for certain people who have the ability to pay for those services. And if you cannot pay for those services because you don't have a good insurance, or what you rely on welfare or Medicare, most of the time you don't have really an effective type of insurance. And that in itself, when it comes to what sorts of, that will determine what sort of healthcare service you receive, depending on your socioeconomic status. And in some cases, depending on the society, the community in which you live. What sort of services are available to improve your health? Then you have the socialism. In most cases, when it comes to health, this is where the Democrats, expansion of services, increase more people so that create that playing field so that everybody have access to good quality care to improve their health. But most of the time, again, it's a big challenge. That's why even in our country, there's always this debate. When Democrats try to promote services for all, Republicans, their response is, how are we going to pay for it, or who is going to pay for it? Different value system. You have the nationalism. That's context dependent. You have the feminism, changes in service provision and treatment to promote female equality. So because again, within the healthcare system, women usually do poorly overall. So, then you have the environmentalism, sustainable development for health reduction inequality. So at times, sustainable creates that situation wherein people live in healthy environments, healthy households, good drinking water, good food, not living in food deserts, but good food, not living on food that they can get from convenience stores, which are in most cases are usually loaded with salt, fat, and sugar, and a lot of preservatives that are at times not good for their health. So the environmentalism are trying to develop those sustainable development, those conditions that can reduce inequality. Ideological and healthcare. Now, healthcare in the US is underpinned by neoliberalism ideology, which is purely is insurance, will result in more inequality and poorer health outcomes. You see, you have some other countries in Europe that wherein health is almost like the socialist approach. You have better health outcomes. In America, we pay so much for health, but at the end of the day, it's still the outcome is usually poor because people who don't have access to good health insurance most of the time don't have access to appropriate primary health care. They only go to the hospital when they are seriously ill. And in this country, people are not necessarily torn down when they go to the hospital, but in most cases, they receive either sub-treatment and that can lead to poor health outcome because people don't have health insurance, don't go for medical checkups as often as they should. So they wait until they are seriously ill. By then, it's much more expensive to treat. But when you move on to the treatment phase, who benefits? It's the insurers. It's those people who own the hospitals. It's those people who manufacture all these various things that are used in the treatment process at the expense of the patient. The principles of equality and redistribution of health are seen as fundamentally good for health. It's very, very important. If everybody is given the same form of treatment, it's going to be extremely helpful. How important are health services? There is an array of evidence to demonstrate that health and illnesses are determined by many factors other than individual treatment. Only 25% of the health of developed populations is attributable to its healthcare system. Health services favor clinical interventions to treat illness and disease rather than dealing with environmental and cultural factors that cause ill health in the first place. Primary prevention. See, at the end of the day is because of the profit motives in our healthcare services, there is much more focus in the treatment of disease, the clinical intervention to treat the illnesses and disease rather than dealing with those environmental factors, dealing with housings, food situations, air, and some of those cultural factors which will contribute to ill health. There is the place we should start. That is the primary care. The sad part of it is because of the profit motive, the primary care will not bring in profit. When people know what to do, when people live in good housing, in healthy homes, healthy physical environment, healthy social environment, and practice cultural factors, most of the time for those in the healthcare services don't see much profit. They would rather do a very timid kind of assistance or assistance to those primary issues. And when people get sick and are disease ridden, for them to be involved so that, see, our healthcare system here is to a great extent depends on what type of card of insurance do you have. And most of the time, some people don't even have a card. So that's why, even though we spend so much, the outcome is usually not as good. Healthy public policy is policy that has a clear and explicit concern for health. See, healthy public policy is a policy that has a clear and explicit concern for health rather than profit. See, because if the profit will be attained in a different way, but if the policy is not geared towards maintaining health, and in developing the policy, the idea of profit is interjected into the whole profit process. I don't know how healthy that policy is, because in a country wherein you have the haves and the have-nots, there's a lot of inequalities that exist. So if our policy in this country is made a focus on and clear focus on health, then it's going to be much more helpful. As the determinants of health are so broad, healthy policy, public policy need to have a broader focus than just health. So that's where comes the social determinants of health. Because these are all issues. Even right now, the type of broadband that people have in their homes, that contributes to their health. Do they have access to reach their doctors, to FaceTime, to Zoom with their doctors so that they can address issues? What sort of employment do they have? Because the employment also will determine what sort of insurance people can have. Level of education. What are the resources within the community that promotes health? Yes, there are so many factors. What sort of attitudes that exist in the environment? Do people really care for each other? Because these are some of the things that contribute. Say in 2006, a health bill in the UK ensured that smoking was made impossible in many spaces. Similarly, in this country, you don't smoke in public buildings, inside public buildings. Primary objective is that healthy public policy was to reduce exposure to secondhand smoke for workers and the general public, with the secondary objective of reducing overall smoking rate. Broader policy, environment, and health. Many government activities affect health and illness. For example, the taxation of certain products, the regulation of air and water pollution, the safety of food, and the work environment. Taxation of certain products. Tobacco is there's an amount of taxation that goes into tobacco because Now people have really known that tobacco causes a lot of health-related issues. It costs you more now to smoke. The regulation of air pollution, so that people living in certain environment, the air they breathe in is being regulated. And water pollution, what are the chemicals in the water that people drink, wash with? The safety of food. We receive food from different countries in the world. What are their health practices in preparing some of those foods? Every now and then we hear certain food types have been taken off the shelves because they are not safety for consumption. Yes, when government is willing to really do their stuff, they can do a good job. And also the working environment, the safety, the physical safety, the social safety, to reduce accidents and to reduce harassment and to be treated fairly. The biggest health outcomes, again, have resulted from public health measures, such as removing impurities from water and improving nutrition. So now the drinking water has to be tested. And if there are certain impurities in the drinking water, that water is deemed not good to be used for drinking. Either it should be boiled for a certain time so that you kill all the necessary microbes, or filtered to remove certain impurities, other like metals, heavy metals, and improve nutrition. The need for balanced diet, needs for vegetations, fruits, some amount of carbohydrates, fibers. But most of the time, there comes some of the challenges. How many in our population that really benefit from all of these great innovations, these great strategies? Those and the haves and the have-nots. Those people live in areas wherein they have most of these challenges as not as you hardly hear of any of these challenges. But those people who live in areas that do not have the poor socioeconomic status, there is still challenge. Even though some advances have been made, but still more to be made. Removing of impurities from water. A few years ago, we heard about the lead pollution in one state that were affecting people living in certain environmental conditions. And you know the impact of lead in the development of children. people living in impoverished environment, people getting their food from convenience stores. What sort of nutritional food do they get? Do they get enough vegetables? Do they have balanced diet? Or do they just have some of this very high on salt, very high on sugar, very high on fat? And one thing about those three things, if a child grows eating those things, the possibility for them to grow obese is very, very high. And the introduction of compulsory seat belts wearing in the UK in 1983 as a transport policy has had clear health benefit by reducing the number of deaths in car accidents. That is similarly so in the United States. Seatbelt has really improved greatly the number of deaths that are involved. People wearing seatbelts, lives have been saved. People have not been thrown out of the car and smashed. Being in the accident restrained, reduced the amount of destruction. So that has been great. Now you have policies as detrimental to health. See, most of the time, as with anything, you have policies that are great and policies that are not so great. The broader policy environment can also be determined and detrimental to health. The policy to generate nuclear power led to the 1986 Chernobyl disaster, which caused many long-term health effects that are little understood. Especially now that we're talking about climate change. Where are we going to get the source of our source of energy to make us enjoy the life we live in? Some are saying, well, maybe build nuclear plants, because nuclear plants have little or no carbon imprint. But they have a lot of other chemicals in them. If things go wrong, that can be really very, very destructive to people's health. A lot of carcinogens. So it's one of those, the discussion continues. In 2005, changes in the UK licensing law outline extension to the hours in which alcohol can be sold, led to what critics call a 24-hour drinking culture. Again, when is it time for people to stop drinking, go home and rest? Because by encouraging people to drink all the time, 24 hours, all you're doing is you're creating a lot of people who are mentally impaired due to drinking, and also you have sclerosis of the liver, which down the road can kill them. You see, most of the time people cry for freedom, 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 without really knowing the 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 other side, the side effect of some of the freedom that people are crying for. At times, it's much better. We as a society can do better when we have honest scientists who are not paid by lobbyists to come and speak to the public as to what is right and what is not right, and what are some of the side effects and potential cost. You see, because today, yeah, we all promote scientists, but for every issue, you have a scientist who will say one thing, then a scientist who will say something else. One of the two is wrong. And most of the time, it doesn't take much to know who is wrong. But especially in our country, as we are divided at this point, you have some people who shamelessly go on TV, promote certain behaviors that in the long run hurts the very people that they are trying to protect, just for fame and profit. Because again, policies are made by people getting together, seeing an issue that needs to be treated. They advocate. They become advocates for those things that they are interested in. But because people are interested in certain things, you also have to look at where are they coming from with this amount of interest? What are their biases? How is this going to impact people? What is the ethics of the researchers? Because if researchers are not there to really tell us the truth based on their findings, and some religious institutions, religious leaders are not there to tell us the truth, we are in trouble. Because that's why in today's and there are certain people don't even trust politicians anymore, because most of the time they've been proven to be wrong so many times. So policies should be developed for the good of the people for which that policy is being developed for, not for people at the other side benefiting from that policy. Now you're talking of fiscal policy. Policy can be used as a mechanism to try to change people's social and emotional well-being and improving health by generally tackling the economic circumstances in which they live. Well, right now, this is one of those policies that, because of the COVID, the government has developed so many kind of helping policies to help those people who are out of jobs, or employers to keep their workers. And at times when those people are kept in place, that can help also with their mental health. When you employ somebody and that person knows that, okay, he or she can provide for his family to meet their needs, their mental health is usually in better hands. There is a large bank of evidence that shows how income levels are strongly correlated to the health of people. Again, I've been saying this at various sectors of the chapter or the course. One's socioeconomic status can influence their health. People in good socioeconomic status most of the time have the means to access health services, health care in a timely manner that will improve their health. Those people in low socioeconomic status don't have those opportunities. And when they access health in their timely manner, and so usually their health outcome is not as good. Policy can be designed to try to support those on lower incomes. For example, to redistribute income by applying progressive taxation rate. Again, these are some of the challenges. People, you have a situation wherein people, in some situations, people are not willing to be able to pay more if they make more in taxes, so that they can be able to take care of those who don't make as much. See, again, that is a value system. Say, well, how do they think? What is their relationship to those poor people? Are we all one? Do we have that common humanity wherein we should be able to help each other? Or do we just believe that, hey, I have it, it's mine, and it's mine. I can use it the way I want to. Those without, tough. See, again, these are some issues. These are all people's value systems. Policy concerned with money and general economic use to try to tackle problems such as inequality will also benefit health. See, if only people are really willing, especially those who have, pay more taxes. Because most of the time, poverty in this country is lack of resources. See, lack of resources lead to other conditions. Even some of these social issues, there's violence. If people have the resources, people can be able to detect certain situations at very early age and say, okay, if we don't fix this in time, this is going to lead to some problems. Two, Wilkinson and Pickett argue that income distribution provides policymakers with a way of improving the well-being of whole populations. Words like this could be considered a big for some people because as long as people think that it's my money and therefore I can do with my money with what I want, I don't care for the situation for them, that group. We're going to have these inequalities in all aspects of our society, health being one of them. And one of the, as they say, when people don't have health, they don't have much. Because even those with money, when they are really challenged with the serious health conditions, their money does not mean much. So these are some of the issues that we have to deal with. The more we all try to really reduce the health gap, the wealth gap, the better we can also hold people accountable. But when with that wealth gap is not addressed, it's hard to hold people accountable because people have to operate, people have to survive based on what they have. If they live in poor environments, they have to live there because that is all they can afford. If they live in slums, they will have to live there because that is to hold them accountable for living in slums, right? But if we can improve those living conditions, those food conditions, those drinking water situations, we can go a long way in improving the health of people. Okay, the summary. Social policies as a discipline is crucial in helping us to understand how the social and economic environment in which we live influence our health through the mechanism of health and welfare. Health and welfare policies are important determinants of health, underpinned by complex ideological values and beliefs. Health policy and health public policy are important for our health, but the complexity of social policy field means that many sectors are important in determining health outcomes. So we have to deal with, especially when we're dealing with a society, they have made so many competing factors. We have to deal with the judiciary system. We have to deal with the educational system. We have to deal with some of the environmental policies. See, all of this have to work hand in hand. We have to also create those policies that create access for people living in low income conditions, access to adequate healthcare services, access to to healthy food. and access to doctors, doctors who are willing to spend time with them to study their situations. Because most of the time, the symptoms are just symptoms, could be caused by a multitude of issues. When a doctor can spend time with a patient, a relationship is built. The patient is far more willing to come out and explain what goes on in their environment. That can be helpful in coming up with an appropriate intervention. See, as there was the critical, policies are very, very critical when they are developed purely in helping to improve the health of their communities or of the people living in their communities. That should be the focal point, not the profit, nor the other sort of things that are just distractors. The policies should be geared towards improving the health of people. Government have the power to do that. At times, they should also have the willingness to do that. Because when you have a healthy population, you have a productive society, you have a productive country, wherein you have more people contributing to the success of the country. When you have certain part of the population not being healthy, then you are really not using the full force of the people that you have because of certain policies that are in place and are making it impossible for certain members of your population to be as effective as they could be. Okay, the lessons ends here.